Welcome, everyone. This is the Career Journey Podcast. I'm your host, Brittany Avila, and this is our first interview episode. So thank you for checking us out. This interview was so much fun. I got to talk to Dr. Emmie Hebert. She is a clinical psychologist and board-certified behavior analyst, currently working at Jumpstart Autism Center in Denver, Colorado. Emmie and I go back to our grad school days. We went to the University of Mississippi together, where we both got our doctoral degrees. She was in clinical psychology and I was in experimental psychology. So we weren't exactly in the same program, but still in the same department and got to know each other pretty well. And this conversation was great. We had a fun ride of figuring out exactly how she decided to get into clinical psychology. Spoiler, she didn't want to work with people for most of her life. So it's exciting to figure out exactly how she got to working directly with people. So without further ado, enjoy Dr. Emmie Hebert. Hey everyone, welcome to the Career Journey Podcast, where we explore exciting careers and how to get them from the people who've lived it. I'm your host, Brittany Avila. Thank you for tuning in and enjoy. All right. Hi, Emmie. Welcome to the podcast. Thanks for coming today.
Yeah, no problem.
All right. So Emmie and I know each other because we went to grad school together at the University of Mississippi.
Mm-hmm.
And we're going to talk a lot more about that later. But I know you're not from Mississippi. You're from Louisiana, right?
Yeah, South Louisiana, right by the Gulf of Mexico.
All right. What's it like growing up there?
It was interesting. A lot of hunting and fishing, rural area. My dad actually still doesn't have Wi-Fi. He lives out in the country, buys some sugar cane. So lots of outdoor activities, and it was a lot of fun, but very different from living where I live now in Denver.
Yeah,
with the city. Houses weren't really next to each other where I was from, so.
Yeah, and how's your dad doing with no Wi-Fi during quarantine?
Oh, he has a wiener dog, and he and his wiener dog go out in the field and ride the four-wheeler, and they always have projects going. So he's doing just fine without his Wi-Fi.
That sounds fun. That sounds like something we all need once in a while.
Right.
So what did you always want to go into clinical psychology, or what did you want to be when you were a kid growing up in Louisiana?
So I actually wanted to be a veterinarian.
Oh, okay.
I still do. I love animals. And I was a really shy kid. And so I thought, well, if I'm a veterinarian, then I can work with animals and I don't have to talk to people as much. I can just, spend more time with animals than people. And so I really wanted to be a veterinarian, especially with small animals and pets like dogs and cats. Horses and cows kind of scare me, but I love the smaller animals. And so that's actually where I started in college as pre-veterinary is what I majored in.
Okay, so that was your first major in college, was pre-veterinary?
Yeah.
I mean, it sounds like you've done a complete 180 now that you work with people in clinical psychology, whereas you wanted to not work with people in veterinary school. So bring us back to that kind of undergraduate experience being in that major. What made you decide to leave the major?
That's actually a funny story. After my first year of pre-veterinary, I took a math class, and I love math, but this particular math class was very challenging for me, and I got a C in that class. And when I went to my advisor, he was not the nicest person. And he told me that veterinary school is the hardest thing to get into, like the hardest grad program to get into, and I would not get in with a C in math.
Don't they all say that? And it's funny because clinical psychology now is touted as the hardest grad school to get into.
Exactly right. So yes, if you look it up, clinical psychology is harder to get into than vet school.
Right.
But when he told me that, I was very discouraged and decided right away to go switch my major. And I've always been interested in like how the brain works and that type of psychology, again, not wanting to work with people. I wanted to like study the brain and see why things happen, be more like experimental side of it. And so I decided I would just switch over to psychology and see what happens. It was kind of a rash move, just, spontaneously. Let me just try this on for a second. And then I loved it. And so that's where I stayed the rest of my undergraduate career.
Awesome. So you only switched your major once?
Yes.
I switched a few times.
That's common to switch a few times.
Yeah, and I had a similar experience where I failed biology. I got a flat out F in biology, and everyone kept telling me not to take like biopsych when I was a psych major.
Mm-hmm.
Turns out neuroscience was easier for me than biology. So
there you go.
Sometimes the advisors just get it wrong. You probably could have still stuck it out.
I know. I have friends who have gone to vet school who, made multiple C's in their classes.
Right.
But I'm glad that the path ended up where it did.
Yeah, it sounds like you're where you're supposed to be. So you ended up in psychology. You were thinking experimental psych. You still didn't really want to work with people. So what brought you over to applying to clinical programs?
So I had a class with Dr. Emily Sandoz, who it was one of my first psychology classes, and she was just starting. It was her first time teaching as a professor at a university. She had just graduated, and she was like, "I'm going to start this lab," and I was like, "That sounds experimental." So since it was new and there wasn't a lot of people there, I was like, "I'm just going to go try it out," and so I went and. It turns out it was not experimental. It was very clinical. So she studies acceptance and commitment therapy and taught a class on, so ACT is how we talk about acceptance and commitment therapy. She taught a class on ACT. And after that class and after being in her lab for a semester, I decided that maybe this might be the right path for me. I was still more interested in figuring out how to do more experimental things, but with a clinical flair to it. And at that point, I knew that I would have to do some clinical work, but I as a young undergrad thought that maybe I could get around it. Like, I'll do, my clinical work on the side, but mostly focus on the experimental part. Because I'm just a curious human. I really love to know how things work and figure things out, why people do things the way that they do. And so that's what really drew me in. But Dr. Sandoz is the one that kept me in the clinical side.
And you're having this kind of theme of curiosity, which is amazing. Curiosity kind of makes the world go around. Definitely in a clinical setting, you want to do this. We're talking about kind of the experimental versus kind of clinical side. Do you want to walk the listeners maybe through what clinical psychology is really like and how it's different than either just an experimental program in psychology or even like therapy or counseling in other forms, just so we can kind of see what those sides are?
Sure. So in clinical psychology, whether it be a master's degree or a PhD, there's two parts. You're going to have the research part. So you're going to be doing experiments or studies that are clinically focused. So we're talking about things that we would deal with in clinical psychology, like depression, anxiety, coping. But you're not directly dealing or doing patient work at that point. Sometimes when you get more advanced in your career, you might be able to do that. But at the beginning, you're doing more surveys or just one time somebody comes in, does something, you measure their behavior, and then they leave. And then the other part is you have practicum or field experiences where you actually do therapy with a supervisor. So your supervisor is either in the room with you, watching tapes, listening to recordings, or you go in and tell your supervisor what you did and they give you feedback on that. So you're actually practicing therapy while you're doing research at the same time, as opposed to the experimental side, which you could talk more about that than I can. But my understanding of the experimental side is it's really focused more on that research and experiment than the therapy part of it.
Yeah, it's pretty much just the research. So I have the degree in experimental psychology. So Emmy and I were in different areas within our PhD programs. And experimental is exactly that research that Emmy was talking about. Sometimes it's with kind of abnormal issues. So people that want to still research areas related to kind of clinical reasons. But most of the time, it's just understanding, again, how the mind works, how behavior works, how people interact either by themselves or in groups. And you're just doing that research side with no practice, no working with people, just kind of where Emmy said she wanted to be in the beginning.
Right.
Okay, so let's pick back up. What about like therapy and counseling, and how is that different from clinical?
So counseling, it's always a hard question to answer because if you were to look at a clinical psychologist and a counselor side by side, it would look very similar what they're doing. A lot of the times, and this is a very general statement, so it also depends on what program you go to, but a lot of the times clinical psychologists have more theoretical training than a counselor does. So you could think of a counselor more as a technician where they're taught the skills to use in the therapy room. They know how to go through protocols. They know what to do in the room, but they aren't necessarily highly trained in the back end in the theory of those skills that they were taught at school. Whereas a clinical psychologist gets that really heavy training in theory and why we're doing the things that we're doing in sessions, why you would pick one therapy over another therapy. And able to be a little bit more flexible in the room than a counselor who is taught, this is what we do, XYZ, now go do it.
Okay, I definitely like that analogy of kind of a technician versus theoretical. I'm going to start using that when I advise students. Normally, I just say it's pretty much whether you want to do research or not.
Well, that's a big part of it too. If you like completely hate research, then PhD program's not really for you.
Right.
Yeah.
Because those counseling, like you were saying, so if you're doing counseling or therapy, if your end goal is to work with people, so opposite a little bit of what you had wanted, then those programs, if you don't want to do research, would be perfectly acceptable, right? Those would be exactly where you want to be because it's exactly what a clinical psychologist is doing, just without that extra theoretical research side of it.
Exactly right. And there are some counseling programs who do have some theoretical classes in it that you could take. That's just a blanket statement that if you really want the theoretical background in the research, then you would be more likely to find it in a PhD program than in a counseling program.
Right. So definitely some counseling programs still have it. And there's way more others. We won't get into them today, but like PsyD, things like that.
Right.
Listeners can go to the forum on the webpage if they want to talk about those ones.
Yes.
So again, we have this running theme that you didn't really want to work with people, but you ended up liking kind of clinical topics and you went into that research. You kind of ended up there, circumstance, you ended up in a lab with a professor you really liked, and you started getting into that research and kind of fell in love with it. So what brought you to continuing on with clinical and deciding to actually work with patients rather than just kind of experimenting with it?
Right. So during undergrad, in my junior year, an autism center opened up in the town that I was going to school in. And this seems crazy now, but it was the first autism center there within a 5-hour radius.
Wow.
Yeah, it was pretty crazy that there were no services at that time. So they were an autism center that did applied behavior analysis, which I know your department's familiar with.
Yes.
And applied behavior analysis is the foundation of acceptance and commitment therapy. And so I had some taste of ABA, so applied behavior analysis, ABA. I had a taste of ABA, and Dr. Sandoz just highly encouraged that I went and did an internship there so that I can get more of a theoretical foundation for ACT. And the ABA that we do with kids with autism does not necessarily always look like ACT, but that's where it was born out of. So I wanted to see what that looked like. And so I went and did this ABA internship, and I fell in love with the kids. They were amazing. My younger brother has autism and interestingly enough, at the time he was not officially diagnosed.
Oh, wow.
So my parents always knew that there were some difficulties, but didn't really know what was going on. And again, we had no services where I was. And so as I was seeing these kids, I was like, that's my brother. That one's my brother. That one's my brother. And so my internship there actually led to him getting a diagnosis of autism. And
Wow.
yeah, so I have that personal connection too of growing up with a brother with autism, and also just the science behind behavior and these amazing behavior changes that I saw in these kids. So back to what I said before of me loving to know how things work, why things work, tinkering with behavior. That's what ABA is. And it was the center that I was at was very protocol driven. And so when you think about clinical psychology, going into a room with like, what am I going to do today? What are they going to come in with? Can be pretty scary. But in ABA, you go in with, this is my program today. These are the behaviors that I measure, and this is how I do the behavior change. And that was comforting to me as a highly anxious person going in. So having those protocols, but then learning the theory behind those protocols, why things were happening the way that they were, seeing the behavior change. I mean, my favorite moment that I still remember, it's almost been 10 years now, is a child that came in with no words, no eye contact, with basically stim in the corner. And I walked him out to see his mom, and he told me bye-bye for the first time.
Oh.
I'm like getting choked up just thinking about it.
Oh, those are the moments we all crave.
Exactly. And so at that point, I was like, well, this has got to be part of what I'm doing.
Awesome. So that was kind of your aha moment where you figured out exactly what you wanted to do.
Yes and
Kind
no.
of.
Yes, so I knew exactly that I wanted ABA, and then it was like, but I like this ACT thing too. And so then I was kind of torn between, do I do the ABA route, so get a master's in behavior analysis and become a board certified behavior analyst, or do I be a clinical psychologist and do ACT with the ABA Foundation?
Or combine the two somehow, which we'll talk about in a minute, because I want to kind of reverse a little bit for our listeners that don't necessarily know what behavior analysis is. I know I have a lot of students that kind of come in with this assumption that behavior analysis is akin to kind of what the FBI does to track down serial killers.
Yeah.
And so would you mind walking us through a little bit about what kind of ABA does for kids with autism?
Sure. So for kids with autism in particular, we are looking at the context of behavior. So when behavior happens, what came right before, what was happening during, and what came after, and how those things influence the prevalence of that behavior. Does behavior keep happening in those same contexts? Does it stop happening in those contexts? And what can we do to alter the environment to change behavior is the very short version of what ABA is. And ABA isn't just for kids with autism. Like, you could think about ABA for yourself.
Right.
Yeah. So like when I do a behavior, what came right before and what came after it? And is that influencing why I did that behavior? So ABA is for everything
Yes.
is my mantra usually. So yes, very interested in how things, and it ties back to very interested in how things work, why things work, and how can we tinker with things to change behavior. And there was my love for behavior analysis.
Awesome. So behavior analysis sounds like it's checking all those boxes for you, that curiosity, tinkering with behavior, being able to kind of solve problems from the get-go, kind of reducing that anxiety you were saying you had of not kind of knowing what to do.
Absolutely.
So what drew you to ACT, acceptance and commitment therapy? Because that's a little different than applied behavior analysis, right?
Yes. So it's not as clear cut as you would see in like an autism center with ABA, but it's using the same principle. So if someone comes in and they say, I'm depressed, I'm sad all the time, I can't find joy in things that I love anymore. In ACT, we would say, okay, what behaviors are you doing? What came right before? What came right after? And how can we alter your environment to make it so that it's more likely that you come into contact with things that you enjoy? Sounds just like ABA.
Yeah.
Yeah. And I mean, there's also training around it. Like, you would also want to, and this is students bring this up too when we talk about ACT. Like, you would also talk about what medications are you taking? How much sleep did you get? How much exercise are you getting? So all of the things in a person's environment and behavioral history lead up to the specific behaviors that we're seeing right now. So it's not just in the moment, it's everything around the behavior.
Nice. It sounds exactly like questions I ask my students when they ask me how to do better on exams.
Exactly right. And taking an exam is a behavior. So what are you doing right before? Yeah.
So ABA and ACT can be very beneficial for students, even just learning how to study and have those good study habits.
For sure.
So is ACT and ABA typically combined with one another? Was there a program or a way for you to do that, or did you have to forge a way? How did that work?
That's a fun question. So if you were to ask me that at the time that I was applying, I would say never, not really. There were 2 programs that I found that combined them. Now there are more. But at the time, and just for your students too, when you're applying to PhD programs, both clinical and experimental, you're not only looking for a program that has something you're interested in, you're looking for specific advisors. And that's why it's so hard to get into these programs, because you have to match not only the program, but the advisor.
And was it kind of nerve-wracking to have only 2 options to apply to, especially to a clinical program where it's hard to get into?
Yeah, so there were 2 best options. I applied to other things.
Awesome.
So backing up a little bit, when I was trying to decide, should I go to a master's or PhD, I was 100% convinced that I was not able to do a PhD. I was like,
wow,
not for me, not going to do it. I'm not going to get in. It wasn't that I didn't think that I could do it.
Let's pause here just to say that Emmie was like the rock star in our PhD program. Everybody went to her for stats and guidance on the experiments. So to bring back her humility, she was amazing.
Oh my goodness, you're very
all right, but you were nervous, you were scared.
Yeah, and I said I'm not gonna get in. But part of ACT actually is noticing the thoughts and feelings that you're having, checking in with your values, and doing things that are consistent with your values, even though you're having those thoughts and feelings. So while I had the thought, I'm never going to get in, I applied to them anyways, because it was part of something that I really cared about. And I never wanted to look back and say, well, what if? What if I would have done this? What if I would have gotten in? Who knows? So, and with Dr. Sandoz, she was like, oh, you're so ready. You're so ready. And I said, I'm going to prove to you that I'm not ready by applying to these.
That's an interesting way of doing it.
Right. So I applied to both master's and ABA programs and clinical psychology PhD programs, 2 of which were perfect fits, 2 of which were not perfect fits. And then the master's programs, I knew that I would have fun with those either way. So after I did that, the long wait, and then I got into
agonizing wait.
I got into both of the ABA master's programs, and so I had Plan B, and then did the interviews with the clinical psychology programs, and I got one of the programs that had the ACT and ABA. So the University of Mississippi, Dr. Kelly Wilson is the co-founder of ACT. 100% you have ACT there. He also ran a lab with a behavior analyst. Both of them studied at the University of Reno. So
where I teach.
Yes, exactly. And so it had both. It had a behavior analyst and the ACT guru. And so I knew that would be the perfect place, and I knew that I was not getting in. And again, I went to the interview, did my thing, and 2 months later got a call and was asked to be in the lab and be Kelly's student.
Wow. And so that sounds like it's complete perfect fit. Was it hard to make the decision since you got into other programs as well?
No, I said yes on the phone.
Very excitedly?
Yes.
Awesome.
Well, PhD programs are hard too, because if you say no to a PhD program, then you basically can't apply there again. They're not going to
waste their time.
And I knew that it had everything that I wanted, and so I immediately said yes, even though Kelly was like, take a few days. I was like, nope, this is it. Gonna do it.
Awesome. So can I back up just a little bit when you were saying how you were determining whether you wanted to apply to master's program versus PhD programs?
Mhm.
How did you make that decision? How did you know that the PhD program was better for you than any of the master's programs that were out there?
That's a good question. I have a good answer and an honest answer.
Awesome. Give me both.
Okay, so the honest answer is PhD's higher, so I said yes.
That
That's,
is very common of my students.
yes,
Everyone's always, oh, I need a PhD because it's the highest.
yes.
Sure.
That's the honest answer.
Okay.
And because my advisor, Dr. Sandoz, told me that that's
Right.
what was good for me, and so that's what I did.
And
Uh,
wanting the title is a perfectly valid reason for going to
yeah,
it. I tell students that all the time. If you really want the title of PhD or what I want a doctor,
yeah,
um, it's a valid reason.
yeah.
All right. What's the good answer?
The good answer is that I worked at the autism center, where I worked, had an issue with getting kids diagnosed. And so the BCBAs there, so the board certified behavior analyst with just a master's, could not diagnose autism. So the kids that came in that really needed services without diagnoses were turned away. And that killed him and it killed all of us because we could see clearly that this kid could use ABA. This kid most likely had autism. At the time, I didn't know how to diagnose autism, but like you could tell for some kids that like they really needed to be there. However, there were incompetent doctors that couldn't diagnose. There weren't a lot of diagnosticians where I was for autism. And it was heart-wrenching at that time. And so I knew that with a PhD, I could diagnose and treat at the same time. So if I worked in a clinic, I could really bring something to the table that would be really helpful to the kids and the families in the autism community.
That's amazing. And so I like this theme of kind of the good answer and the honest answer because I don't really think that they're separate. I think that they're both reasons that you chose to do that program, and both are completely valid and completely good reasons to do it. So I think you can kind of bundle those into the same
Another way
category.
to put a bow on top of that is with a PhD, you can do more in general, and especially in clinical psychology. It opens up so many doors, whereas a master's, you're kind of in the spot where you were trained and you can't really go outside of that.
Right. So for you wanting to do kind of multiple things, it worked really well to have that flexibility.
Right.
Whereas if somebody maybe wanted to just do that one counseling thing, it could work for them.
Mm-hmm. And I
Good.
always tell students, if you want to, like if your goal is to be a clinician for, say, I want to treat kids with autism and I really want to develop treatment plans and study behavior analysis and help improve their life, please just go get a master's in ABA. Like, there is no shame in getting my favorite people in the world are BCBAs. And this is a taboo subject with the money, but BCBAs make a really good living and they just have a master's degree.
That's what I tell people all the time who come in for like clinical psychology. I'm like, if you're just doing clinical work and you're just doing that and you're not doing that extra diagnostic, you're not doing that extra theoretical research work, you're going to be making about the same amount of money.
Yeah.
Without I know. I talk about money all the time because I have a PhD and I don't make a lot.
Right.
And so you can get that PhD and not necessarily make more than people with a master's or even with a bachelor's degree in some areas. Obviously, psychology, usually you need a little bit more, but the money's not always following the higher degree.
Absolutely. And when I switched my major to psychology, I told, I guess, one of my mentors from when I was younger, I told him that I switched to psychology. And he said, what do you call somebody with a psychology degree? And I said, what? And he said, a waitress.
I was going to say barista.
See? Yeah. Yeah.
I've heard that too. Yeah.
Yes. And so there is this taboo that like you don't make a lot of money in psychology, and it's true. And you have to have the heart for it and know what you're doing. But if you know what you want to do and and like, you know exactly where it is, and it doesn't involve research, and it doesn't involve that theoretical background, and you really just want to help people and do the therapy, please go get a master's.
Yeah, and I tell students all the time too, you can make a lot of money in psychology doing other things too. So psychology is a very broad area. I know we're focusing mostly on clinical and ABA today because that's what you do. There's also just, you can work in businesses with industrial organizational psych.
Mm-hmm.
You can work in health sciences and community health, all different stuff. So we won't get into all that today, but
Yes.
there's a ton of different areas in psychology that actually make more money than I do.
Yes.
And there's different ways to do it. With a master's in counseling, if you have your own practice, you can make a lot of money.
Absolutely.
So, and money is a valid reason for choosing a career too. I always tell people that.
Yes.
I feel like
it's true.
Young students are always like, well, I know I don't want to talk about money. And I'm like, money matters.
Yes, you do want to talk about money, actually. And you want to talk about money early.
Yes. You want to know early on. All right. So now you're in the PhD program. You're doing exactly what you want, kind of the cross between the acceptance commitment therapy and the applied behavior analysis. What were your next steps? Where'd you go?
I had no idea.
You had no idea. So you're
Yeah.
in clinical PhD. You're supposed to have this focus, this goal,
Right.
and you had no idea?
Well, you have to remember
That's
that I
awesome.
didn't think I was going to get in.
Right?
And so after getting in, my world was turned upside down. I moved away from home for the first time. So in undergrad, I lived with my dad with no Wi-Fi. That was fun.
How do you do undergrad without Wi-Fi? Oh, no.
Hotspot on the phone.
Oh my gosh.
Yes, it was pretty intense. But so moved away from home for the first time. Luckily, I had already built a relationship with the co-person that ran the lab with Kelly, so Dr. Kate Kellum. I met her at conferences before, which is why it's cool to go to conferences as undergrads because you make those connections. And so I knew her, and that was pretty much it, what I knew in Oxford. And so having to build my way, and I knew for the first couple years there wasn't a lot of pressure on what are you going to do after you graduate. It's kind of a few years to try things on. So trying on individual therapy in a clinic, so doing therapy with adults versus doing therapy with kids versus doing therapy with individuals with disabilities. So my first practicum was at an adult facility for individuals with developmental and intellectual disabilities, which I loved. You'll see. This will all wrap up at the end that way. But trying different things on and practicing being really open to new things that I was scared of. I think that was the theme of my graduate career is this is the time to say yes to as many things as I can, as many experiences as I can, and to try on different things and see what fits for me. Again, like I said, I was terrified of doing therapy because I have pretty severe social anxiety. And so I did not want to sit in the room with somebody and not know what to do. It terrified me. And so trying that on, I did like it. I like doing individual therapy, but found throughout the years that I really enjoyed working with individuals with intellectual and developmental disabilities. And it's so funny because if you look at my practicum and what I did in grad school, it's like 1 year with typically developing people, 1 year with intellectual developmental disabilities, 1 year typically developing, because I kept going back and forth, trying out new things, but I just kept coming back to autism, ABA, developmental intellectual disabilities.
Well, and it sounds like a perfect fit with you not necessarily wanting to work with people from way back your beginning, wanting to be a veterinarian and not wanting to deal with people at all, to being able to work with people in a very structured way to reduce that anxiety. I also really love in your story that you do have social anxiety and some anxiety issues that didn't prevent you from doing what you wanted and doing amazing work with people too. So being in clinical psychology, I know a lot of young people that have anxiety issues that are scared to go into these areas. And so hearing your story should be really helpful to them.
Absolutely. And I was, like I said before, my biggest fear was walking into a room and not knowing what to say. But when you go into these programs, you have training. Like
Right.
you know what to say when you walk in. I have at this point and throughout my graduate career, it got to the point where the anxiety came more at the beginning. So right before and as soon as I walked in and opened my mouth, it was fine.
Exactly. I always say that practice, 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 right?
Yeah.
Is the more you practice, the less that anxiety goes. So I teach, I still get nervous right before I go to class every single time. I teach 3 days a week, all year round. And
Yes.
I still get nervous right before, but just what you're saying, as soon as you open your mouth, it comes out, you know what to do. That kind of practice training takes over.
Absolutely. Absolutely. Yep. Um, And another thing about my graduate career was that our program didn't have a behavior analysis focus at all. I had Dr. Kellum, who was a behavior analyst who I soaked everything up from. So there was a point where I sought out my own practicum in behavior analysis. So there wasn't one built in, but I had a connection in the area and just asked. And that was another piece of graduate school and undergrads. And I think everybody should learn this skill is that the worst that can happen when you ask for something is they say no.
I always say they can't say yes if you don't ask. So you can't get what
Exactly.
you want if you don't ask.
Yes. And
Good.
so,
And
yeah,
working on your social anxiety by asking for something that wasn't there.
exactly right. So, and I asked and they said yes, which was amazing.
Yay.
And so I was able to get more intensive ABA training with a practicum that wasn't there before. And it's there now. It's still there to this day.
That's
Um,
amazing. You paved your own way and created something for future scholars there.
yes. So I think a little bit of my graduate training was me just asking for things and getting surprised
Yeah.
with the response that I got from that.
I think the biggest thing I learned in graduate school was to make my own way and start kind of doing my own things, where I was more of that follower. I did what everybody told me to do.
Absolutely.
And grad school was that training ground where I learned, oh, it's not always there. Sometimes you've got to make it happen.
Yes.
All right. So then you're kind of bouncing back and forth between the typical development, intellectual disabilities. You obviously have said that you landed on that intellectual disability side and wanting to do that. So what was next? What happened kind of after that grad school?
So what a lot of people don't know, and I didn't know, was that you go through your clinical training and you finish everything, but then at the end, there's this thing called an internship, um, where you're not graduated yet, but they send you off to this place where you get more intensive training outside of your program. So I moved from the University of Mississippi all the way to Omaha, Nebraska to work
Wow.
at the Monroe Meyer Institute, which is a institute for kids with disabilities, and they even have a behavioral pediatrics for kids that are typically developing. But in one building, they have recreational programs, speech, OT, PT, psychology, ABA, all in one building. It's an amazing program. And so if we get a kid that comes in and they have a speech issue, we send them downstairs. And so, again, like my whole career bouncing back and forth, I decided that I wanted to do an internship with typically developing kids, but I wanted it to be behaviorally focused. So I found behavior analysts that were doing behavioral work with typically developing kids in an outpatient setting. So the kids came in once a week and we did therapy with them and we did parent training with their parents. By the end of that year, I was working with kids with autism. Surprise! And doing autism evaluations. But I really wanted that last chance to really be sure that autism was where I wanted to go. And was it just the kid thing or was it the autism thing? I found that it was the autism thing. But I really enjoyed working with kids and learned new skills in that program. And one thing that was really cool for me during that time was that I was the only person there that was highly trained in acceptance and commitment therapy.
Nice.
And so I was able to teach other clinicians that skill. And here's a surprise for people who want to work with kids because you don't like adults, is that you're working more with adults than you ever had before if you work with kids.
Yes.
So you have the parents, the teachers, the caregivers, the siblings. There's just, you're working with way more people if you work with kids. And so I found that my generalist program at the University of Mississippi and Learning Act really helped me to work with the environment of the child that was my direct client. So I was able to do the ABA with the kid and use ACT skills with their parents, which was amazing.
Yeah, definitely. When you're working with kids, you have to know how to work with and kind of tiptoe around the parents too.
Absolutely.
And do you find, so you kind of, again, switched back and forth between typically development and intellectual disabilities and kids with autism. Do you find that that constant switching maybe gave you some extra skills or things that you could incorporate that maybe other people didn't have?
Yeah. So they say if you meet one person with autism, you met one person with autism, and there's a whole spectrum. And so we have the kids that are nonverbal, highly stimming, kind of in their own world, to the kids who, if you didn't look close enough, would look typically developing. And so having those skills to be able to work with all different types of children really lended its hand to broadening my skills in both acceptance and commitment therapy and ABA, and just as a clinician in general.
So not necessarily knowing where you want to go can end up helping you and giving you kind of an advantage and a skill.
Nothing is a waste. You always use what you learn.
Awesome. So now you're in Omaha, Nebraska, right?
No,
And
I'm actually in the Denver area now.
okay. So that's where you were in Omaha, Nebraska. So how did you get to Denver?
So my partner lives in Denver, and I knew that after I graduated, I needed to be here, whether that be in a psychology position or working at Walgreens. I needed to be in the Denver area. We did long distance for 4 years, and I was done.
Yeah, I've been there.
Yes. So what people also don't know about clinical psychology is you graduate, you get your PhD, you're called doctor, and you need another year of training before you get licensed. So
there's a lot of steps.
Right? There's something called a postdoctoral fellowship that everybody does to get those hours before licensure. And so that's what I'm doing now. I'm at an autism center in the Denver area called Jumpstart Autism, and I'm the postdoctoral fellow there, which means that I work very closely with the licensed clinical psychologist in the center, learning everything that she does, doing everything that she does. Her name gets put on everything, though, and she supervises everything that I do. So not quite independent yet, still, baby psychologist, but getting to do things a little bit more independently than I was in grad school.
Good. And I like this idea that some of your career choices have actually been personal choices, right? Trying to be next to your partner, things like that. I definitely have that same. During grad school, me and my partner were separated. We were long distance too, and we knew we needed to go somewhere together. So sometimes when making these career decisions, it's not necessarily all about that idealism of what you want for your career. Sometimes it's a practical, I need to live here.
Yep.
So great that you were able to find a postdoc fellowship and didn't have to work at Walgreens.
Well, that's actually a funny story too. So when you're looking for postdocs, there's a website that you can go to that lists all the accredited postdocs that are available. There was one in the Denver area that I applied to. And then I searched psychology, ABA, Denver area, Googled it, and emailed all of them.
Wow.
There weren't that many, but I emailed all of them and was like, would you be interested in a postdoc? And one of them emailed back and was like, we don't have a postdoc, but maybe. And so they wanted to meet with me, and we met. They've never had a postdoc at this location before. This psychologist had never supervised anybody else before. And they were just in the position to be able to do that. So it was really, I want to say luck, was really lucky that happened. And that I had that skill of the worst they could say is no. And
Right. And
if I wouldn't have asked, who knows what I would be doing now.
I know, I love this theme in your life of making your own way, making things happen for you, calling people outside of what that prescribed list was.
Mm-hmm.
And it worked. That's a lot of career decisions, is just putting yourself out there and asking people who aren't even looking. And maybe they have enough funds to take you on and give you a job, and here you are.
Yeah. And at least if they couldn't do it, they would know my name so that when I was ready to be hired, they had my name there.
Exactly. Always put your name, because in psychology, we always learn and teach that familiarity is the best. If somebody's more familiar with your name, they're more likely to positively associate with it.
Yes, exactly.
All right. So what are you doing now? So you're in that postdoc position, Jumpstart Autism. What does your kind of day-to-day life look like? What are you doing?
Well, there's pre-COVID and post-COVID.
Right.
So it looks a little bit different now that we're in the pandemic. So before COVID, my main job, and even now, my main job is to do autism evaluations and do the diagnoses and recommendations. So we have kids come in, we have like a 4-month wait list, and we do gold standard autism testing. So the ADOS is what the gold standard is. We do developmental testing or intellectual testing, depending on how old the kid is, cognitive testing. And then we're able to do a diagnosis and recommendations. With younger kids, we do everything on the same day. So it's a 4-hour appointment where parents and kid comes in. We do the interview with the parents, test with the kids, give them a little break. We score everything and then come back in and say yes or no autism, which is really nice for families because then it's only one trip.
Yeah, it's a long trip, but it's all
it's
done at once. That would be an amazing relief for parents.
Yes. So we test kids as young. I think the youngest one we had was 1.5, and then the oldest one we've had is 17. And so all of those ages, testing looks a little bit different. So that's most of what my job is. I'm also a behavior analyst, which we can get back to that if we want to get how I got there. But so I'm able to do direct therapy with kiddos. So we have an evaluation part of our clinic, and then ABA part of our clinic, direct therapy. So I do direct therapy with the kids there. I supervise some RBTs to do direct therapy, and able to work with the kids on their cases and be on teams that way as well. So I'm getting the evaluation side and the applied side.
Great. So where do you see yourself going next? Or do you know where you're going next?
Yes, I do. So COVID has actually been, it's been really stressful. So we're doing evaluations over telehealth now, which is insane. But it has also given me the opportunity to show how my ACT skills are really important. And so during this time, I was able to run a couple parent groups. So parent support groups of like, hey, I know life is hard in general having a kid with a disability, and I can't imagine what it's like now. And so having those groups where we learned ACT and mindfulness skills, taught the parents those things. And then also working with some of our higher level learners on mindfulness and ACT skills for themselves as well. And I wouldn't have necessarily gotten that opportunity as quickly as I did if it wasn't for COVID. Because there were learners and parents that are that my supervisor and the owners were like, what are we going to do with these people? And so I was able to jump in and show, hey, I have this thing that we could do. And it's been amazing. And so to answer your question, where am I going next? I'm going to stay at Jumpstart. I love Jumpstart. It's been the most amazing job and experience that I've had to be able to see the ABA side and work with the BCBAs, but also bring in my psychology training to work with parents and staff. ACT is really great for staff. Like you were saying, it's great for studying and students. It's really great for staff. And so being able to have both sides, so like at the beginning of my story, I wanted ABA, I wanted ACT, I have it at the center, and it's been amazing. And so my plans are to stay at Jumpstart, and it's 10 minutes from our condo. I get to live with my partner. It's just been awesome.
And what's it like? So you've mentioned in the beginning that Denver was very different from where you grew up in Louisiana. Is that something you're taking into consideration? Do you like the different? Do you like being in a different place?
I'm allergic to Denver. So I have finally found my allergy routine.
Nice.
And since then, it's been really great. I love seeing the mountains. It's something, every time I see them, I'm like, whoa, because where I come from, it was so flat.
Oh, I remember that in Mississippi. You thought Mississippi had hills in there, and it definitely did not.
But now we go down the street and we can see the mountains. It's amazing, and I really love it. We're close to my partner's family, and so we have people around that we know. We have 2 nieces here. So yeah, it's awesome.
Great. And I'm going to go back a little bit, but I love that circumstance has kind of led you to a career path too, where this pandemic, and I think for a lot of people, may have led to kind of new career paths or forced career choices, things like that. So knowing that it kind of helped you figure out what you want to do is pretty amazing.
For sure. Yeah. It's very hard and such a hard situation, the pandemic, but it has offered myself some opportunities that I wouldn't have had before.
Yeah. I mean, it offered the start of this podcast. So same with me. So we're coming up on time right now. So I just want to ask you kind of one last question. If you could give advice to someone, maybe a young student or someone trying to transition to a new career that's maybe thinking of clinical but doesn't quite know what they want to do, what advice might you have for them?
I would say if your university offers it, to join a lab with someone who's a clinician. So another thing at the University of Mississippi was that they had research labs that allowed their undergrads to be exposed to talk about clinical work. So if their research lab advisor was also a clinician, they were able to talk about clients and how the research was applied to their client or what they did with a client in a particular situation. So I would say try that on. Research labs are a great way to try on research. So as an undergrad, if you get into a lab and you absolutely hate the research part of it, then maybe start thinking about a master's in clinical or ABA. So I would say just as much exposure as you can to try on the job without actually doing it.
Right. That's really good advice. Definitely wanting to get into that field. That's how I determined I didn't want to go into like criminal psychology, because I met with somebody who worked for the FBI and I was like, oh, no, thank you. That doesn't sound great to me.
That's a really great point. Interviewing or like sitting down and talking with someone who actually does it is a great way to do that too. Psychology is a hard one because you can't job shadow because of HIPAA and like there's a lot of confidentiality things. But talking to people about it, finding grad students in the program that you're interested in and talking to them is a good way to get a taste of what it's like.
Well, awesome. That was great advice. Thank you for everything. Thanks for sharing your journey with us. It was excellent to hear. And thank you for being on the podcast.
Absolutely. Thanks for having me.
Thank you so much for listening. Head over to our website at careerjourneypodcast.com for more info, the latest episodes, and to join the discussion about careers. See you next time.